The Channel Mom Show, celebrating you with Jenny Dean Schmidt.
Okay, are you ready for some fun tips on how to look good and slow down your skin's aging process? Well, I sure am. Dr. James S. Beckman is a chemist and board-certified plastic surgeon and the founder and CEO of Therapon Skin Health. Following his surgery residency at the University of Arkansas Medical Center and a plastic surgery residency at the University of Tennessee in 1977, Dr. Beckman did set up his private practice, plastic and reconstructive surgery, where he worked with burn victims, among other things. In response to skin concerns voiced by his patients, Dr. Beckman has developed some very simple steps to restore aging skin. And I love this as a mother. He has applied these principles as the CEO of Therapon Skin Health. Welcome, Dr. Beckman.
Well, good morning.
You know as well as I do that most moms still want to look good, despite the fact that they're running around taking care of kids and a little bit harried. And at some point, most moms would also tell you that they would like to look younger than they are. So for that reason, I'm excited to share with moms what you know about how skin ages. Literally, scientifically, you understand it and how to slow that down. But here's what I really appreciate about you. You were out there being a doctor and actually using your medical experience and expertise to help a variety of people, including burn victims. Tell us about the work that you did that helped you discover what you needed to do for aging skin.
Well, in reconstructive surgery, you're seeing not only burn victims, but hand injuries, facial trauma, congenital defects, just the full mix of something that's wrong with a patient, and they come to you to be restored, or repaired from that. In the process of the philosophy of reconstructive surgery, you look first at what the cause was. What's making the symptoms be there? If it's a muscle that's not functioning, it may be a nerve problem. In the case of skin, and much of reconstructive surgery practice involves trauma where skin is lost and a skin graft would be put over that area. It's not totally the same full-thickness skin that's adjacent to it. So it helps to cover the gap to get people back into activity.
Sure.
May leave a functional defect, difficulty flexing hands and that sort of thing. So I had been, from my training, I'd learned that if you use a very high animal oil lanolin content cream, lanolin actually absorbs into the skin and gives pliability back and removes the dryness that's there. Long in the mid-'80s, late '80s, I had done facelifts on 6 patients prior, 6 months to that, and I just happened to see these ladies back in the same week for a follow-up check.
Mm-hmm.
Every one of them said, "Doctor, I look 10 years younger at 50 feet away, but my concern is when I put my makeup on in the morning, I'm up close to the mirror, and I see the same paint, the same skin surface that was there before, the fine lines, wrinkles, and dry skin. What can you do about that?" So I said, well, obviously you need to restore the skin to its pliability and those sort of things, but you also need to care for your skin prospectively to prevent further damage.
Mm-hmm.
And a number of those patients had also had burns or dry skin that I had written the high
prescription
oil
for the
content of the lanolin cream for.
Mm-hmm.
And some of those, a couple of those ladies were in that group of 6, and they said, I used that really extreme oily cream on my face. Can you make something a little less heavy that would be more like a facial product? So I went to the library and pulled all 384 articles from 1950 at that time on dry skin, rough skin, irritated skin, wrinkled skin. And 2 articles had one single-line statement: if you use lactic acid with a moisturizer, any moisturizer, it'll make the moisturizer penetrate better.
Oh, that's why we have the lactic acid in your product.
That's how, I'm just, methodical and plain and not really a brilliant person, but I remember what I saw before yesterday and apply it to tomorrow.
Uh-huh.
I said, well, why don't I make a lighter weight moisturizer lanolin based, and let's make up some lactic acid. And for the next year, every patient that comes in my office is going to get some lactic acid and a facial moisturizer at no charge, just to try and see what it does.
Yeah.
And we started that process, and in about 6 weeks, everyone that used it came back and said, my skin feels so good. I've received a compliment from my spouse or a friend or somebody that my face looks nice, and asked what I'm using. Well, other plastic surgeons heard about that and said, well, get us some of that stuff. So that's how a company started, not really to manufacture skincare products and supply them to the world, but to supply my colleagues and plastic surgeons.
Sure. Now, can I tell you, that is what I like about you. We only have about 3 or 4 minutes left, but I appreciate the fact that you came upon this just trying to help people, including people that were truly suffering, like burn victims. Now, can you just tell us in a minute or two, you also have a heart just to help people for free overseas because you do medical missions. Can you tell me about that?
Well, yes, ma'am. I've been on 28 short-term trips to different places, 4 or 5 times to Russia. The most interesting was in 2003 when I went to Basra, Iraq, and it was in July. The war had started in April, and I was on a civilian humanitarian mission, and I got plugged in with a plastic surgeon there that was the only plastic surgeon for 2 million patients, and a number of his patients were burn victims and mortar and landmine and other injuries that way. But that's the most gratifying thing in the world to me, is to give somebody the ability to get some semblance of normal life replaced again. So I see that when I go to Africa or India or places of that sort on medical missions. And
you feel called to do that, literally. Is that something you felt God called you to do?
Well, yes and no. Obviously, if you're buying your own ticket and providing your own supplies and don't charge anybody, it's not a profit-making venture.
Yeah, right.
But I am so blessed every time I get to do that. I try to go once a year to somewhere.
Right. I appreciate that. We've got about 2 minutes left. So you have put these products into Therapon Skin Health, which I happen to use and really believe in. There's a whole process that moms can just pick up and use. Is that correct?
Well, it is. And for anything to work, it needs to have a regular basis to it. It has to be formulated to meet principles that are actively doing something. So we formulated some principles to clean, to exfoliate, to restore damaged collagen that's there, and then to repair the lipid barrier with a moisturizer, and formulated those products to do that. So in 2 minutes, twice a day, anyone can use this, and it's I've been gratified to see people enjoy using it.
Yeah. I mean, I don't like to promote vanity too much, but I'll tell you what, as a mom and as a wife, you do want to look good, and I don't think there's anything wrong with that. So I want to personally thank you for working so hard to create this for people and for coming up with Therapon Skin Health. So we thank you so much for being with us today, Doctor. It was a joy to talk to you.
Well, it's my pleasure, and I wish all your moms the very best.
Okay, thank you. Take care. Have a good day.
You too.
All right, bye-bye.